Hi, my name is Alex, and I'm here to affirm the resolution that California should repeal the Medical Injury Compensation Reform Act. Roadmap. For today, I will be giving definitions, setting a judging criteria, providing some background information, showing the harms that this act causes, and set a plan to solve the harms. Definitions. Malpractice means improper, illegal, or negligent professional activity, especially by a medical practitioner, lawyer, or public official. California has caps or limits in the amount of damages that can be awarded to a victim of medical malpractice. Malpractice premiums, the annual fee paid by a medically qualified doctor or other licensee to practice insurance carrier to uncover the liability of medical practice. The Seventh Amendment, the amendment codifies the right to a jury trial in civil cases and inhibits courts. And some of the cases are considered frivolous and people are losing their right. Judging criteria. If I can prove that the Medical Injury Compensation Reform Act of 1975 has undercut the rights of the people in California injured by the negligent act of our healthcare system, then I shall win. If my opponent can prove that I am wrong and this act is good, then I shall lose. Background. For way too long, the people of California who have been harmed instead of healed by our healthcare system face an obstacle when we seek accountability in a court of law for medical negligence. The obstacle is the outdated act called the Medical Injury Compensation Reform Act of 1975, or MICRA for short. Significant harms. Money. MICRA has put a $250,000 cap on pain and suffering damages in cases involving medical malpractice. According to Robert S. Peck, the president of a law firm dedicated to challenge that impede the access to justice, says that MICRA has taken away crucial economic decisions out of the hands of citizens. Money is only given to non-economic damages. Non-economic damages include claims for pain and suffering, loss of consortium, both of which permit the financial recovery for losing limbs, losing eyesight or hearing, the ability to walk, and all other losses that do not directly relate to economic losses. The loss of a child due to a preventable medical negligence is valued at no more than $250,000. Subpoint 2, roadblock. MICRA not only has a cap, but sets a roadblock to the justice system for people harmed by negligence. According to Robert S. Pack again, medical malpractice cases are long and difficult, with the cost attorneys rising to $100,000 or more. Those expenses are not recovered unless the victim prevails against the teams of insurance industry lawyers who defend negligence cases. With the tight caps on potential judgments and attorneys taking cases on a contingency fee basis, causes many victims not being able to find an attorney who can afford to take their cases. Contingency basis fees means that lawyers are not paid unless they win the case. According to Harvard University, a study done by the Harvard Medical Practice Study Group determined that for every 8 potential medical malpractice claims, only 1 filed. Many lawyers and victims are intimidated, so never file because they are most likely going to lose. Inherency. The current act that is in place is currently preventing Californians from being able to receive more money that they deserve and are not being able to practice their right of the Seventh Amendment. The plan on the AF team is to eliminate the $250,000 cap that California has set. There will be no cap. The health insurance are going to pay for the errors the doctors have made. Solvency. To solve for harm 1, with the removal of the $250,000 cap, patients will receive the money they deserve due to the medical errors they have received. For example, according to Miller and Soy's law firm, a victim at a hospital was giving birth to her child. Everything was completely fine, but her baby was born with a respiratory congestion and was unable to breathe. None of the doctors that were present in the delivery room were qualified for the procedure to remove the congestion, so the baby died of asphyxia. If the victim would have lived in California, she would have only gotten $250,000. But since she currently lives in Pennsylvania, she got a total of $7 million. She got what she deserved. How to solve for harm 2. With the cap not in place, lawyers are going to have the right to practice law and not feel intimidated. It will also give them the opportunity for them to make more money since they are working on a contingency basis fee. Advantages. Advantage 1, taxpayers are not going to pay anything. Taxpayers should not worry in paying anything and worry that the health price will go up. Insurance companies are going to be solely responsible for the money that victims get. Advantage 2, the people are the ones that want MCRA to be taken off. According to the House Resolution 5 from the bill that was presented in the House of Representatives, Californians overwhelmingly oppose their state's cap. A statewide poll of Californians shows 74% approve of removing MCRA's limit on non-economic damages. In certain cases, 66% believe that MCRA should be eliminated for doctors who negligently harm children, and 58% believe that MCRA cap should be eliminated for doctors who negligently cause death. Conclusion. I have shown that there are many problems with the current act that is in place, and it needs to be changed in order for victims to get their money and deserve the chance for a fair trial provided by the 7th Amendment of the Constitution. I am Alex, and I'm here to affirm the resolution that California should repeal the Medical Injury Compensation Act.
It says 3 behind you, but it's going to be 2 minutes cross-check.
Okay.
So you were mentioning the 7th Amendment, right?
Yes.
All right. Did you know that the 7th Amendment only applies to federal courts and not state courts?
I wasn't aware of that.
All right. Next question then. Can you explain the roadblock of the justice system? I was kind of like lost. How you were
Okay,
explaining it.
so it sets a roadblock to the. Okay, so I mentioned before that there's some of the cases are considered frivolous, so they never get the chance to go into a courtroom.
Oh, okay. That's fine. Do you think $250,000 is a lot of money?
Nope. Well, at the time that this act was put into practice, that was 1975. So like now, due to inflation and everything, I feel like that price is outdated.
Okay. And then do you think the doctors are intentionally being negligent?
In some cases, I believe they are.
You believe they are.
Mhm.
Are you guaranteed? Are you sure?
I'm not sure.
Okay. No further questions.
Just 1 second. All right, Kyle, you ready?
Yep.
Go.
Hello, my name is Kyle, and I'm here to negate the resolution that California should not repeal the Medical Injury Compensation Reform Act. So, a roadmap. For today, I will be providing definitions, setting my own judging criteria, providing some background information, showing the disadvantages to the app's advantages, and why if we change the status quo, other problems will arise from this change. So for definitions, I agree with the app's definitions, but I would also like to include one I will be using a lot during my speech. So according to businessdictionary.com, economic loss is financial loss to a business or person resulting from death, injury, disability, property damage, or destruction caused by the negligence acts of a third party. For my judging criteria, if I can show that there is no current problem with the status quo and that the app are creating new problems by changing MCRA, then the neg shall win this debate. So for background, under MCRA, injured patients are fairly compensated, medical liability rates are kept in check, and physicians and clinics can remain in practice treating patients. MCRA has no limits on the economic losses that can be recovered by injured patients, so basically medical costs and lost wages or the money that they could have made working but can't because they are injured. Injured patients also can sue for unlimited punitive damages and recover up to $250,000 in non-economic losses. In addition, MCRA includes a sliding pay scale which ensures that most of the money goes to the patients and not lawyers. The $250,000 cap on non-economic losses is an effective way of limiting frivolous lawsuits and keeping healthcare costs low, but has been targeted by the trial lawyers because it restricts the amount of money that they can collect in damage awards. Increasing MCRA's cap on speculative, non-economic losses will have a dramatic, costly, and negative impact on the cost of healthcare in California and will seriously impede access to care for patients who need it most. So to refute the app's harms, to refute harm one, there is a reason that there is a $250,000 cap limit. According to CMNet.org, while eliminating or increasing the Medical Injury Compensation and Reform Act, or MCRA, on non-economic losses will impact physician medical liability rates. It would also lead to higher costs and reduce access for patients. Basically, California trial lawyers are currently pushing a proposal to raise the cap on non-economic damages to as much as $1 million, which would be devastating to both physicians and healthcare consumers. A recent study done by William G. Ham, a PhD for a Berkeley research group in 2008, found that just doubling MICRA's cap to $500,000 could cost consumers and taxpayers in California $9.5 billion a year in higher healthcare costs. So although the app says that a higher cap will benefit the injured because they get more money, in reality, people in California will have to pay more just for health coverage. That is why the $250,000 cap is in place, to ensure that patients are being compensated to a maximum extent, but also to ensure that people in California don't have to pay more taxes just to have health coverage. For this reason, harm 1 causes problems to the status quo if the status quo is changed. To refute harm 2, there is no roadblock. A lawyer in California currently makes around $100,000 a year according to Salary.com. So if a lawyer is charging a simple $100,000 for a case while a lawyer makes an average of $100,000 a year, it doesn't really make sense. The reason that lawyers and the injured want higher rates is simply for more money. Everyone can agree that every single person in the world wants a lot of money, and the best way to get it is through compensation. Even then, the cap for MICRA is $250,000. The injured and lawyers are still getting a lot of money, with most of the money directed towards the injured. So for this reason, there is no roadblock and there isn't a second harm. So to refute the AF's plan, the AF wants to create a plan that they say will fix the current problem with MICRA, but I have shown that there are no current harms with MICRA, so why does it need to be solved? To refute the solvency, the AF says that by removing the current cap limit of $250,000, that people will be receiving more money than they deserve. A New York Times article done by Bryce Covert in 2015 states that the most recent Census Bureau data shows that the median household income, what people in the exact middle of the American spectrum earn, is $53,657. Those families who make over $250,000 a year, on the other hand, belong to an elite group, Americans who can earn or who earn enough to be in the highest 5% of the income distribution. Basically, the other 95% of people don't even come close to making $250,000 a year. So raising the cap limit is unjust. Again, by raising the cap limit, people have to pay more money in taxes so they can be covered just because someone wants more money in compensation than what the average American makes. Raising this cap limit is greedy and unjust, so for that reason, the AF has no solvency for their first harm. The AF's plan can also not solve for their second harm. In American society, it is commonly known that lawyers have a high standing in society and make a lot of money. The AF argues moving on to disadvantages. So for my first disadvantage, taxpayers do have to pay more in taxes. With the AF trying to change the status quo, it causes the people to have to pay more for health coverage, while the AF argues that taxpayers don't have to pay. Nothing in life is free, and someone always has to pay for something. So for these reasons, the AF's supposed advantage is actually a disadvantage. And for a second disadvantage, yes, Californians may want to remove the cap of MICRA, but Californians have already tried to raise the cap and it failed. According to kbps.org, on November 4th, 2014, Proposition 46 failed with 67% of voters rejecting the measure. California Proposition 46 would have raised the MICRA cap to current inflation standards, approximately $1.1 million with future annual adjustments. So although the AF argues that Californians want to raise the cap, they have already tried to do so and it failed. So there is no advantage to the AF's argument. So in conclusion, I have shown what MICRA is, disproved the AF's argument to change MICRA, and have shown how changing the status quo creates more problems than there already are. My name is Kyle, and I'm still here to negate the resolution that California should not repeal MICRA.
If a doctor were to, by any chance, make you blind, would $250,000 be enough for you?
No answer for that question.
Okay. Is there a cap on economic losses?
I am not sure about that.
Okay. What are examples of economic losses?
I cannot give you any.
Okay. Is $250,000 a lot of money for you?
In my opinion, yes.
Okay. Do you think $1 million would hurt a financially solvent healthcare system?
Yes, I do believe so.
Okay. How is the income distribution relevant to this?
Next question, please.
Okay. Do you know what Prop 46 is?
Yes, Prop 46 was a proposition that was put into place, like I said, on November 4th, 2014, which basically would have raised the MICRA cap to current inflation standards, which is about $1.1 million in today's money.
No further questions.
Can you grab a minute? Sorry.
No.
Okay.
Hi, I'm Alex, and I'm here to affirm the resolution that California should repeal the Medical Injury Compensation Act. Okay, so my opponent talks about how the economic damages can be accounted for. But economic damages cannot always be anticipated. California juries are not informed on the cap or on non-economic damages, so they are often not careful about apportioning economic damages. In one famous case, according to the Consumer Watchdog, for example, Harry Jordan, a Long Beach man, was hospitalized to have a cancerous kidney removed, but the surgeon took out his healthy kidney instead. A jury awarded Jordan more than $5 million, but the judge was required to reduce the verdict to $250,000 due to California's cap on non-economic damages. Jordan, who lived for years on a 10% kidney, could no longer work. Jordan's court costs, not including attorney fees, accounted to more than $400,000, and his medical bills were added to that. That arose after frequently being denied by insurers totaled more than $500,000. What money did he have left? None. There are many stories like this. The NEG also claims that it will cost taxpayers a lot of money towards their healthcare insurance. According to the Consumer Attorneys of California, California's healthcare system has continued to skyrocket at a rate faster than inflation since the passage of MICRA. It's already happening under MICRA. People are having to pay for this tax on their healthcare insurance, but the Consumer Federation of America reports that medical malpractice premium comprise only 0.059% of national healthcare costs. So for my opponent to say that it will rise their healthcare does not make sense if it does not make up a significant amount on our healthcare. The NEG also states that people wanted change under MICRA when Prop 66 was on the ballot. The Coalition to Protect MICRA is the group of board members that represent insurance firms, hospitals, and physicians that fought hard for this ballot not to pass. According to the CAOC, the healthcare industry deep pockets were on full display leading up to the November 2014 election as malpractice insurers and others spent nearly $60 million to defeat Proposition 46. Okay, if hospitals did not have the problem, they wouldn't have. If hospitals had a problem, they wouldn't have a problem with the removal of MICRA. They are professionals and should not worry of being negligent if they are doing their job correctly. Not only can you see that they wasted a lot of money to stop Prop 46, but it shows that there is a reason why they are opposed to it. The point of MICRA was to keep insurance companies financially solvent. Insurance companies benefited from this. According to the Consumer Watchdog, California's medical malpractice premiums increased dramatically during the first 13 years. California was again faced with the insurance crisis, with the medical malpractice premiums so high, rising at a rate of 26% annually, faster than premiums rose nationally. A good attack on MICRA was Prop 103. Medical malpractice rate had fallen by more than 20%. During the first decade of regulation, premiums were down by 7%, and if we adjust to inflation, the medical malpractice premiums are down by 35% since the enactment of regulation. This shows that malpractice rates went down since the prop lowered down the use of premiums. If we completely remove MICRA, it seems as if doctors would not be lazy and not rely on malpractice premiums. Conclusion, my name is Alex, and I'm here to affirm that resolution that California should repeal the Medical Injury Compensation Act.
You stated in your speech that about Prop 103 and Prop 66. If you could please both explain Prop 103 and Prop 66, that'd be very helpful.
Okay, so I actually mentioned I actually mentioned Prop 46, and that's the one that I asked you to describe. So you should have you answered your own question. And for Prop 103, hold on, let me see. Ooh, where are you? Prop 103. Oh my gosh. I don't have it on me. Okay, next question.
All right. Can you say that you are human?
Yeah.
All right. Can you say that humans make mistakes?
Yeah.
All right. Can you say that doctors and nurses are human?
Mm-hmm.
So doctors and nurses and people like that can make mistakes, even though they're highly trained professionals. Correct?
Yeah.
All right.
Mm-hmm.
And no further questions. Oh.
I didn't even flow that part. And
Oh my.
wait.
All right. Hello, my name is still Kyle, and I'm still here to negate the resolution that California should not repeal MCRA. MCRA is in place to ensure the safety of doctors and patients alike. Humans are not perfect. We can all admit to some error in our lifetimes. Even though doctors are highly skilled and trained professionals, they are still human, so error is inevitable. We cannot stop it, it just happens. There is no current problem with MCRA in place, so why should we change something that doesn't have a problem? If the AF changes MCRA and does increase the cap that patients can receive, it would affect our state-funded programs. According to the California Medical Association, tax dollars are also used at the state level to fund healthcare services for others. Changes to MCRA will result in increased costs to the state general fund of hundreds of millions of dollars annually by increasing healthcare costs. The following state programs provided will be impacted. Programs such as CalPERS, Medi-Cal, Healthy Families, the Department of Mental Health, the Department of Corrections, and the Department of Developmental Services. Those are just some of the few departments that will be affected. Higher costs for these state programs can be made up in only two ways: increased taxes or cuts to other programs and services, such as further cuts to Medi-Cal, reimbursements, cuts to education, public safety, transportation, or any of the other services provided by the state. So simply by changing MCRA, it could cause more problems and harms than good. People would have to pay more for these things that benefit our society, like education or public safety. And if people can't pay for these things, then these programs will be cut and really affect our society as a whole. The AF can argue that we need to change this as much as they want, but simply changing MCRA will bring more harm than good. My name is Kyle, and I'm still here to negate the resolution that California should not appeal MCRA.
There you go.
Do you know what malpractice premiums are?
No, I do not.
Okay, if humans make mistakes, why do the premiums go up? So premiums are basically insurance provided by insurance companies for doctors who do malpractice.
I couldn't tell you. Next question, please.
Okay, no further questions.
Okay.
You again?
yes.
Yeah.
Wow. Alright, we good? Alright. Hello, my name is still Kyle, and I'm still here to negate the resolution that California should not repeal MCRA. California needs MCRA. It ensures the safety of doctors and patients alike, and it guarantees if something does go wrong while being treated for, MCRA will help you. The NEG have shown that how MCRA is needed, therefore the NEG are winning this debate. Next, I would like to discuss the cap of MCRA. It is absurd that the AF went to raise the $250,000 cap when not even the top 5% of Americans make $250,000 a year. There's no reason or logic behind why the AF wants to raise the $250,000 cap. So for this reason, it shows how the NEG are winning this debate. The AF also failed to show how MCRA's cap is a negative aspect. Therefore, the NEG is winning this debate. If MCRA is changed or repealed, it will cause significant problems as a society in California when it comes to healthcare, public safety, and other government-funded institutions. So since the NEG's disadvantages outweigh the AF's advantages, the NEG have won this debate. The AF have also tried to show examples of when MCRA is used, but it is one example and very weak evidence. So for this reason, I believe the AF's one example should be thrown out. The statistics do not lie. MCRA is a good thing and it is needed in California. My name is Kyle, and I'm still here to negate the resolution that California should repeal the MICLA.
Okay. Okay, so I'm Alex, and I'm here to.
Hold on.
Wait.
Sorry. Hold on.
Okay.
Okay.
Okay. Hi, my name is Alex, and I'm here to affirm the resolution that California should repeal the Medical Injury Compensation Act. So my opponent has said that the people are going to pay taxes, but under my plan, the people are not going to be paying taxes. It's going to be the health insurances that are going to be paying for it. And he claims that all humans make mistakes, but if humans made, if the malpractice premiums went up, it sure shows that a lot of mistakes are being made. So like, if all those mistakes are being made, then why isn't the sorry, I lost my thought. Okay, and oh yeah, sorry. I'm Alex, and I'm here to affirm the resolution that California should repeal the Medical Injury Compensation Reform Act.
Alright, good job.